Hi, everyone. It is the top of the hour, so we're going to get our session started. Thanks so much for coming to ClinicalTrials.gov for librarians. My name is Erica Lake. I'm the Health Sciences Librarians Outreach Specialist for Region 6 of the Network of the National Library of Medicine, and I'm going to be your instructor today. Okay, here's our agenda for the next 90 minutes or so. We are going to begin with an overview of clinical research and explain the significance of ClinicalTrials.gov. We'll talk about how ClinicalTrials.gov is used and by whom, and address the importance of registering trials and reporting results. We'll spend the second half of the class exploring ClinicalTrials.gov through a live demonstration of the website. You can choose to just sit back and watch, or you can follow along by opening a new tab on your computer, using a second monitor, or using your phone to search ClinicalTrials.gov. After the demonstration, we'll do a class exercise together, and we will wrap things up by answering any remaining questions you might have. We do have two class materials to share with you today, the PowerPoint slides of this presentation and a handout containing a resource list and the class exercise that we're going to be doing. Rebecca has put a link for the handout into the chat, and when you click on the link, it will download as a Word document, which you can then open up and refer to during class. All right, that is all I have, so I'm going to turn off my camera now, and we will move into our class content. So we want to kick things off by hearing from all of you. What is your experience using ClinicalTrials.gov? You can let us know in the chat. Are you an expert user? Are you familiar with it, but you want more tips? Do you rarely use it and need a refresher, or is it completely new to you? Okay, these answers are coming in fast and furious here. I'm seeing rarely, familiar, new user. All right. So today's class is designed as an introduction. So those of you who have little experience with ClinicalTrials.gov are in the right place. For those of you who ranked yourselves as experts or very familiar, I hope you'll be able to use today's content to think about how you'll instruct others to use ClinicalTrials.gov. So let's move into our overview of clinical research. What is it and why is it done? Clinical research is medical research that studies people to understand health and disease. The research relies on human volunteers, also called participants, to learn things like how the body works, how diseases develop in people, how the body responds to different treatments, and which behaviors may increase or reduce the risk of illness. Regardless of their outcomes, these studies contribute to our understanding of health and help us improve how we prevent and treat disease. There are two main types of clinical research: clinical trials and observational studies. In clinical trials, researchers assign participants to get one or more interventions to test what happens in people. So this is why clinical trials are also called interventional studies. Those interventions can be a drug, a medical device, or a behavior. Researchers might compare two drugs to see which works better or has fewer unwanted side effects, compare a drug to a placebo, or compare getting a particular treatment to getting no treatment. Sometimes researchers will randomly assign participants to an intervention, and neither the participants nor the research staff will know which group they've been assigned to. And this is called masking or blinding, and it helps ensure results are looked at fairly. In observational studies, researchers do not assign participants to get an intervention. Instead, they collect information from participants or look at data that was already collected to observe how the data affects health outcomes. If there is an intervention in an observational study, participants were already using it as part of their regular healthcare or daily life. Well, let's examine 6 key points about clinical trials now to understand them a bit more. Point 1, informed consent is an ongoing process. Some of you might be familiar with the act of obtaining informed consent from participants before they enroll in a clinical trial. The documents that is used to do this shares important information, including a description of what will happen during the study, how much of participants' time the study will take, any payments participants get from taking part in the study, or conversely, any costs participants may need to pay, and perhaps most importantly, the known benefits and risks of taking part in the study. However, the concept of informed consent is not limited to this one act during the enrollment period. It is a process involving communication, transparency, and respect for participants' autonomy throughout the duration of the clinical trial. Even after signing an informed consent document, a participant has the right to withdraw their consent and leave the study at any time and for any reason. Point 2. Research for clinical trials happens in many ways. For instance, studies can take place at hospitals, clinics, research centers, or universities. They may be conducted in person, over the phone, or online. The research could last a few days or weeks, or it could last for years. And in some clinical trials, all the participants will get the intervention being studied, while in others, only those assigned to a particular group will get it. Point 3, healthcare continues for participants. In most studies, participants can keep seeing their regular doctors. Sometimes they may have to change or limit their usual healthcare, such as stopping other medications they take. If needed, research staff will work with participants' doctors to make sure that being in the study will not cause problems. Point 4, health problems are reported to research staff. Research staff will explain to participants what to do if they have health problems during the study and will usually ask them to report problems to them immediately. The research staff also often includes doctors and nurses who will work with participants and the participants' regular doctors to address problems. A group of experts may also oversee what is happening in the study, and if they have a safety concern, they will alert the researchers. If serious health problems happen to participants during the study, the researchers may stop the study altogether. Point 5, researchers collect data from participants during the study. This data collection may be done through surveys or questionnaires, through imaging like X-rays or MRIs, by taking measurements like height, weight, or blood pressure, or by obtaining samples of blood or tissue to look at in a lab. Researchers may need to collect data from participants many times or only a few times. Different countries have different rules about how researchers can use each type of data they collect. In the US, informed consent documents will often include a statement on what researchers plan to do with participants' data and how the data will be maintained and stored. And point 6, researchers analyze the data to answer their research questions. Some studies will include a statistical analysis plan describing in detail the methods that will be used for data analysis. And having a clear, comprehensive, and transparent plan like this supports the reproducibility of the research. So there are many benefits from having access to clinical trials information. It helps researchers meet ethical obligations to human subjects and informs future research and research funding decisions. It mitigates information bias, like the non-publication of results data, evaluates research integrity, like adherence to protocol, and prevents trial duplication of unsafe or ineffective interventions. It provides access to data that support evidence-based medicine and enhances patient access to clinical trials. Taken together, these benefits contribute to increased public trust in clinical research. As former NIH Director Dr. Francis Collins said, access to more information about clinical trials is good for patients, the public, and science. Okay, I'm going to pause here for just a moment and see if there are any questions that have come up on clinical research.
Nothing is in the chat box yet, but folks can take a few seconds to type, so.
Well, feel free to just keep typing those questions in, even though we're going to move on to the next section, because we can always pick those up again at our next question break. So right now, we are going to turn our attention to ClinicalTrials.gov. The ClinicalTrials.gov is a website and online database of clinical research studies and information about their results. It is the world's largest registry of publicly and privately supported studies taking place in all 50 states and in over 200 countries and territories. So you can think of ClinicalTrials.gov as a library of clinical research studies. It collects, stores, and organizes information as study records, which anyone can then search and access. As of December of last year, ClinicalTrials.gov was receiving about 90,000 visitors per day and 2 million unique visitors every month. So it's important to point out here at the beginning of our class that while ClinicalTrials.gov provides access to study data, it does not own that data. Study sponsors and investigators are responsible for the data that appears on ClinicalTrials.gov, not the U.S. government. The National Institutes of Health and other U.S. agencies only approve the studies that they fund, and the National Library of Medicine only does a limited quality review of the study information that sponsors and investigators submit for inclusion in the database. Neither body does a scientific, legal, or ethical review of all the studies listed on ClinicalTrials.gov. It is the responsibility of the study sponsors and investigators and their institutional review boards to ensure the science is sound and the study is safe. So who does ClinicalTrials.gov serve? The website primarily serves 3 external user groups: patients and their advocates, which include healthcare professionals and caregivers, data submitters of trial information, and researchers representing academic, nonprofit, and commercial organizations. Internal groups that ClinicalTrials.gov serves include various National Institutes of Health policy and oversight teams, information specialists, reviewers, librarians, and developers. Okay, we want to hear from all of you again. Which of these user groups do you currently support or would you like to support in learning about ClinicalTrials.gov? You can let us know in the chat. Is it patients and their advocates like healthcare professionals, data submitters, researchers, or perhaps all 3 groups? Hey, I kind of jumped in here as things were coming up. It looks like many of you aim to support all 3 groups, which is great. Got a lot of researchers in there too. See a few patients and advocates also. Great. Well, let's look at these 3 external user groups in a little more detail now. And we are going to begin with the patient and advocates group. The original intent of ClinicalTrials.gov was to enable more patients to gain access to trials that might help them. For both patients and healthcare providers, the website provides a comprehensive list of ongoing studies and offers a centralized place to search for trials by condition, location, and other trial characteristics. The website also has supporting materials in plain language to aid in understanding the study record data, resource links for learning more about topics and treatments related to studies, and educational information on terminology, the clinical trial process, and the importance of participating in research. The second group of users are data submitters. These are the study sponsors and investigators who submit trial information to ClinicalTrials.gov. Some studies are required by laws and policies to be submitted to ClinicalTrials.gov, while for others, like observational studies, sponsors and investigators can choose to submit them or not. Data submitters are responsible for ensuring information is updated throughout the life of a study. They must update records at least once a year, and certain types of changes like adverse events must be documented more frequently. Submissions and updates are done through the Protocol Registration and Results System, or PRS. Now, learning how to use PRS is outside the scope of this class, but we have linked to help resources on your class handout under the heading ClinicalTrials.gov PRS. The third group of users are researchers. Researchers can use ClinicalTrials.gov to search for information on active and completed clinical trials. They can examine individual study protocols to assist them in developing new methodologies. They can locate data that reveals trends in clinical research to help shape their decision-making about what they pursue next. And they can download study record data for analysis. And the class exercise that we are going to be doing later will get you thinking about ways you might support research teams at your institution. So what about librarians? Well, librarians can use ClinicalTrials.gov in a variety of ways to support all three user groups. They can be their organization's ClinicalTrials.gov search expert with the skills to retrieve trials by condition, location, or phase, identify unpublished research for the inclusion in a systematic review, guide patients and caregivers in understanding trials related to their condition, and conduct training sessions for researchers, students, and clinicians on how to effectively use ClinicalTrials.gov and interpret trial results. Librarians can also play an advocacy role. The National Library of Medicine believes librarians are ideally placed to educate and support researchers at their institutions. For example, through librarians' promotion of the National Institutes of Health public access policy, they have helped to contribute over 10 million articles to PubMed Central, the National Library of Medicine's free full-text archive of biomedical journal literature. In a simpler way, librarians can promote clinical trial registration and results submission and help contribute to more trial results becoming freely available through ClinicalTrials.gov. This advocacy can be done by educating researchers and their staff about registration and results reporting requirements and guiding them through the study submission process. They can collaborate with their institutional research offices to encourage compliance, and they can promote transparency and open science in general. So we are going to explore those registration and results reporting requirements now over the next 5 slides, and I'm going to go into quite a bit of detail. I am going to pause for another question break after we get through this content, so feel free to type your questions into the chat while I'm talking. And also note that we have included information on these requirements on your class handout under the headings ClinicalTrials.gov policy and clinical trial reporting requirements. So ideally, the complete results of all scientific studies would be made available to the public in a timely way. We would expect this because significant public funds are invested in clinical research. And the individuals who volunteer for clinical studies often consent to give up their right to choose an option about their health care and put themselves at risk for these results. However, multiple sources indicate that between 25 and 50% of clinical trial results remain unpublished even several years after completion. Of those trial outcomes that are published, they are often reported and published selectively, depending on the nature of the results. There are numerous ways in which the evidence that appears in the journal literature can misrepresent or underreport the full range of the collected data. For instance, researchers or funders can be dissatisfied with the study results, or journal editors may select studies with more interesting results over those that show no significant effect of an intervention. Details of a study may be selectively reported. For example, changes to a trial protocol may happen mid-study and not be fully reported in a publication, or information about serious adverse drug effects may be omitted. And sometimes authors simply run out of space in a publication to fully report their results. In the end, this selective publication can distort the body of evidence available for clinical decision-making and potentially compromise patient safety. So several policies and regulations have been established over the last 20 years to increase accessibility to scientific study data and improve transparency and accountability in research and study reporting. So before ClinicalTrials.gov even existed, information about clinical trials was scattered across various sources, making it difficult to find studies of interest, learn how they were conducted, or track their progression. In response to calls from patient advocacy groups, Congress passed the Food and Drug Administration Modernization Act of 1997. Among other things, it required the National Institutes of Health to create a public database of clinical trials regulated by the Food and Drug Administration involving investigational new drugs for serious or life-threatening diseases. The resulting public database, ClinicalTrials.gov, was launched in 2000. In 2005, the International Committee of Medical Journal Editors, or ICMJE, began requiring that sponsors and investigators register their clinical trials in a public database like ClinicalTrials.gov. This publication policy required trial registration as a condition for the publication of research results generated by a clinical study. Then, in 2007, Congress enacted Section 801 of the Food and Drug Administration Amendments Act, or FDAAA 801. It expanded the types of studies that were required to be registered in ClinicalTrials.gov, as well as the data and summary results that needed to be submitted. This law applied to specified clinical trials of drugs, biological products, and medical devices. And in 2017, several additional regulations and policies went into effect. One was the final rule for clinical trial registration and results information submission, which further clarified and expanded what needed to be submitted under FDAAA 801. And we're going to look at the final rule in a bit more detail in just a moment. Another regulation, the National Institutes of Health Policy on the Dissemination of NIH-funded clinical trial information, established the expectation that all investigators conducting clinical trials funded in whole or in part by NIH would ensure these trials were registered on ClinicalTrials.gov and their results information was submitted. And the National Institutes of Health amended its policy on the inclusion of women and minorities in human subjects research to require researchers conducting applicable phase 3 clinical trials to submit results of valid analyses by sex, gender, race, and ethnicity to ClinicalTrials.gov. This amendment mandated the detailed reporting of participant characteristics within study populations in major clinical trials. So let's look at the final rule for clinical trials registration and results information submission in greater detail. Henceforth, we're calling it the final rule. The final rule provides a checklist for evaluating which clinical trials are subject to the regulations and who is responsible for submitting the required information. It expands the scope of trials for which summary results information must be submitted to include trials involving FDA-regulated products that have not yet been approved, licensed, or cleared by the FDA. It requires additional registration and summary results information data elements to be submitted to ClinicalTrials.gov, including the full protocol and the race and ethnicity of trial participants if collected. It requires additional types of adverse event information, and it provides a list of potential legal consequences for non-compliance. So those potential penalties for not submitting results include a notice of non-compliance on ClinicalTrials.gov, civil money penalties of up to $10,000 per day of non-compliance, and the withholding of NIH grant funds. So these penalties obviously bring serious consequences, not just to individual investigators, but to their institutions. So given these regulations and penalties, why isn't the number of studies with results in ClinicalTrials.gov even higher? Well, there are two major challenges in submitting results data. The first is a lack of awareness of the results submission requirements. So that is what needs to be submitted and when. And the second is a lack of detailed study knowledge by whomever is submitting results. A data submitter really needs to be someone very familiar with the study and the data. Librarians can position themselves as trusted information partners who can aid researchers and data submitters in navigating the compliance landscape effectively. So if someone at your institution is submitting results for the first time, they can follow the PRS guided tutorials for step-by-step instructions. And we've included the link for these tutorials on your class handout under ClinicalTrials.gov PRS. So the regulations and policies we've just reviewed have helped shape ClinicalTrials.gov into an important source for research information at a level of detail never before available in a public resource. This graph shows the growth of ClinicalTrials.gov from when it was first conceived in 1997 as part of the FDA Modernization Act through December of 2023. So when the ClinicalTrials.gov website launched on February 29, 2000, just over 25 years ago, it contained 2,119 study records. Those study records numbers doubled in 2005, which was the year the ICMJE publication policy was implemented. In 2008, 1 year after the FDAAA 801 requirements went into effect, the ClinicalTrials.gov results database was launched. And in 2019, when the ClinicalTrials.gov website modernization effort launched, there were over 325,000 study records. By December of 2023, that number was over 475,000. And now, in July 2025, that number is over 546,000. So this gives you a sense of the kind of growth that can be anticipated over the coming years. Okay, before we move on to the live demo portion of the class, I'll pause and see if there's any questions on anything that we've covered so far.
Erica, there are a couple of questions, and I think Christina is going to give those a stab, if that's okay.
That sounds good.
I will include some answers for those in the chat.
Oh, in chat?
Unless you want me to, I mean, I can answer live, I don't mind, but I'm also happy to answer in the chat if that's easier, and then everyone can refer back to the information if they want.
I would say go ahead and do it live, if you don't
okay,
mind.
Sure, of course. So there are clinical trial registries across the world. So registry is where the studies are actually registered. There are also many databases that pull ClinicalTrials.gov data and repurpose that for their own websites and databases. In terms of, and we do, I will say, we do actually coordinate with the National Cancer Institute for their database, which is called CTRP, that's Clinical Trial Research Program. And then we are also connected to ERA and Reporter. These are some other NIH systems for reporting and grants management. In terms of other international registries and credibility, so there is also the World Health Organization. They have a registry. Well, I think theirs is actually a compilation of many registries from around the world. The European Union has a registry called CTIS. Several other countries have their own. And then there is also one called the Pan-African that includes all of the African countries. So there are actually lots of registries. I will say, however, that ClinicalTrials.gov is the largest, and we do actually get a substantial number of studies registered from studies around the world. So we get lots of voluntary submissions, which are studies that aren't required to be registered, but for, a variety of reasons, the responsible parties and sponsors want to be registered on ClinicalTrials.gov. Hopefully that answers those questions.
Great, thank you.
Of course.
Yeah, thanks for answering those. I don't have my chat box open, so it's great to know what kind of questions are being asked right now. So thank you, Christina. All right, the moment you've been waiting for, we're going to get our hands on that website now. So the URL for ClinicalTrials.gov is shown here at the top of the slide, and Rebecca is going to drop a link for it into the chat as well. Now, again, you can choose to just sit back and watch the demo, or you can follow along by opening a new tab on your computer, using a second monitor, or using your phone to search ClinicalTrials.gov. Note that if you do use your phone, the layout for some of the content might be a little different from what I'll be showing on my monitor. All right, so here's a roadmap for our demo. We are going to begin with an overview of the homepage just to get familiar with the main features of the website. Then we'll perform a basic search, learn how to use filters, and I'll share a handy search tip involving PubMed. Then we'll do a class exercise together using a research case scenario, and we'll wrap things up by answering any remaining questions. Okay, I'm going to stop sharing my slides now, and we will open up the ClinicalTrials.gov website. All right, so here's the home page, and you can see it's laid out very simply with the intent to make it easy for anyone to use. Here in the center of the page is our search area, where we can jump right into finding studies by entering a few criteria in the search boxes. And we're going to do that in just a moment, but first we're going to take a quick tour of the homepage to get oriented. So above the search area is a brief disclaimer about the website, making it clear that the U.S. government does not review or approve the safety and science of all studies listed on the website. We've got some additional information here under the accordion, and then we can click on the hyperlink here to go to the full disclaimer. Across the top of the page, we have a streamlined site menu, and I'm going to start on the tab on the far left. Under the Find Studies tab and the Study Basics tab is where we can quickly get our hands on search guides and helpful tips. We also have a clinical research glossary and patient resources. Under the Submit Studies tab is where you can find PRS help resources and learn how to apply for a PRS account. The Data and API tab has information on how to organize, search, and retrieve data using the Application Programming Interface tool, or API. The Policy tab has information on clinical trial reporting requirements, as well as some data element definitions. And lastly, under our About tab is where you can read the latest news and updates on ClinicalTrials.gov, and also see the release notes to learn about recent and future upgrades and changes to the website. In the upper right-hand corner is where we have our button to log in to the PRS to register a study or submit results. And moving towards the bottom of the screen now, under the search area, we have two ways to provide feedback. One is in the lower right-hand corner. We have this yellow feedback button. This actually appears on every page in ClinicalTrials.gov. And then towards the center of the screen, under the Help column, we have another link to give feedback. And the ClinicalTrials.gov team reviews and analyzes feedback to help them identify bugs and user requests. And then they integrate this feedback into the design and development process to help shape future releases and features. Also under this Help column, we have a link for customer support. And this takes you out to the National Library of Medicine Support Center and a list of frequently asked questions specifically related to ClinicalTrials.gov. I'm going to click the back arrow now, and we are going to perform a search. So you will notice in our search area in the upper right-hand corner, there is a link for expert search. Clicking on that takes you to an alternative search interface that's more conducive to constructing, editing, and viewing complex search queries. Performing an expert search is outside the scope of today's class. I just wanted to point it out that there is another interface available to you here. But we are going to go back to the home page and do what is considered a basic search. Okay, so here in our search area, Instead of one search box, you see that we have 4. These are our 4 basic search fields or filters. And as it states here at the top, all filters are optional. You do not need to put something in every box in order to be able to run a search. So the first box is where we would enter the condition or disease we're interested in. And anytime you see this little blue info button, you can click on that to quickly access the glossary to learn more about that particular item. So I am interested in finding some studies on breast cancer. So I'm going to type that in simply as keywords, no quotes or anything around it. And you'll notice that as I type, a few suggested terms appear in a drop-down list. ClinicalTrials.gov has incorporated predictive typing, so we could choose one of these terms if we wanted to, or we could go with what we typed in, which is what I'm going to do. I'm just going to leave it like that. In our second box, we can enter other terms that may be important for our search. So for example, the name of a drug or something that is commonly associated with our condition or disease. We're going to leave this box empty for right now. Our third box is intervention or treatment. And this is the process or action that's the focus of a study. So the intervention or treatment could be drugs, medical devices, vaccines, or it could be something non-invasive like education or diet. We are also going to leave this box empty. And our fourth box down here is location. ClinicalTrials.gov has integrated Google Maps API, so you can search as narrowly as a street address. We're going to keep things very broad to begin with and search by country. So I'll type in United States. Now, because of that Google Maps API integration, this is the one field where you do have to select from the drop-down list. So you notice in red, we've got this sentence here, please select a location from the drop-down list. So if I click in my box and then I click on United States, the red has changed to green and it says location has been selected, so we're good to go. Beneath the 4 basic search fields, we have the study status section. So we can select to retrieve either all studies or just those that are recruiting or not yet recruiting. The default selection is all studies, so I'm going to leave that just as it is. And then at the bottom here, we have the option to select some more filters to further refine our search. And we're going to take a look at these in a few minutes. Right now, we're going to run our search by clicking on this blue search button. And our results appear on a new screen. So this is our search results page. So we're going to take a look at what's familiar and available to us here. Our search retrieved 6,699 studies related to breast cancer that are located in the United States. And these synonyms for our condition or disease have automatically been searched too. So ClinicalTrials.gov uses the Unified Medical Language System as the dictionary for these synonyms. The terms we entered, breast cancer, and these 52 synonyms have all been searched on the back end across 7 fields in the study record, including the title, condition, and keyword fields. Going over to the right, we can look at our display order. So the default display order for our results is by relevancy. Relevance is determined by best match to our search terms and the synonyms, and proximity is also considered if a location's been entered. We can change our display order to newest first just by clicking on the drop-down menu. We'll leave ours as relevance. Above this, we have the default view for our results. It's table view. We also have the option to switch to card view. So this just shows us our results in a slightly different format. I'm going to click back to the table view so that we can take a look at the columns that are in our table. I'm going to start on the left-hand side. The first column that we have on the left is the study title column. This displays the study's brief column, which is hyperlinked to the full study record. Our next column to the right is the NCT number. So this stands for National Clinical Trial Number, and it is a unique identifier that gets assigned to each clinical study upon registration in ClinicalTrials.gov. And the format is NCT followed by an 8-digit number. Next, we have the status column that indicates the stage of the study. And then we have conditions, interventions, sponsor, and then let me scroll over to our last column, study type. So above our results, we have an action bar going across the top. I'm going to go over to the far right and click on the Manage button. And this allows us to customize the columns that we see in our table. So we can deselect these default columns that are over here on the left-hand side, and then select any on the right to add to our table if they're of more interest to us. The action bar is also where we can save and download studies, and we're going to dive into this a little later in the class. Right now, we are going to look at ways we can refine our search by applying some additional filters. So I'm going to go to the left of our table and click on the 2 arrows here with the Show button. And this opens up a new area, providing ways to focus our search. So you'll see that our original search terms, breast cancer and United States, are already populated in the boxes, so we can quickly and easily make adjustments to our search. I am interested in studies specifically addressing dense breast tissue because tissue density can impact the detection of breast cancer. So I'm going to type dense breast tissue into the other terms box. Okay. Let's scroll down to see what other ways we might focus our search. So the next section is study status. And let's go ahead and check the box for those studies that have been completed. Next, we have eligibility criteria. This is where you can refine your search by participant sex, age, and health requirements. And we have study phase and study type. And notice that in addition to interventional studies and observational studies, we also have expanded access studies. These are also referred to as compassionate use studies, and they're a way for patients with serious diseases or advanced stages of their disease who can't participate in a clinical trial to still gain access to a drug or a medical device that hasn't been FDA approved for treatment. Okay, continuing down our list, we can filter by study results. Let's go ahead and check the box for those studies that do have results. Then we have an area to refine by study documents, funder type, and then date range. And then finally, down here at the very bottom, we have a few more ways to search. If we have a specific study or a sponsor that we're interested in, we can just type that right in here. Okay, I'm going to click on Apply Filters. And now you see that we have narrowed our search down to 17 studies. So let's take a look at an individual study record now. I'm just going to click on the first study that is in our table, molecular breast imaging as a screening tool for women with dense breasts. Okay, so now we are on our study record page. Up here at the top, we have some key information. We see this study has been completed. We have the NCT number here. We have the sponsor, which is Mayo Clinic. We have the responsible party for this information, and we have the date when the last update for this study was posted. Scrolling down, we are given 4 tabs that we can use to navigate to specific information about this study. And the study details tab is the default view, so we're going to take a look at this one first. The study overview section provides both a brief summary and a detailed description of the study. Now, this study compared the sensitivity of conventional mammography to a new technique, molecular breast imaging, for detecting breast cancer in women with dense breast tissue. On the right side, we have some key dates and numbers for this study. It began in 2005. It was completed in 2010, and there were 969 enrolled participants. I'm going to scroll down now, and here we have the intervention and treatments that were used in this study. And below that, in the blue box here, we have some resource links provided by the National Library of Medicine to information on breast cancer, diagnostic imaging, mammography, and drug information from Medline Plus and the FDA. And patients can explore these links to learn more about the topics and treatments related to the study. Under those links, we had the study contact and location information. So this study just had one location. It was at the Mayo Clinic in Minnesota. If this was a multi-center trial, you could click on the interactive map here and see all the locations at a glance, which is pretty neat. Next, we have an important section, the participation criteria. So this is where you would find the key requirements that people must meet or the characteristics they must have in order to participate in the study. The eligibility criteria consist of the inclusion criteria, which a person must have to participate, and the exclusion criteria, which will prevent a person from participating. And common types of eligibility criteria include age, sex, and health requirements. In the study plan section, you can learn how the study was designed and what research questions the investigators wanted to answer. So, scrolling down here, we see that this was set up with just one arm. It was a single group assignment. So an arm is a group or a subgroup of participants in the study. And sometimes there'll be one arm and that group only receives one intervention, and then the second arm may receive a different intervention, and perhaps a third arm receives no intervention. In this study, there was just one arm. All participants in this study received all three interventions. So the interventions were molecular breast imaging, getting a mammogram, and then having a drug, which was an injection of an agent that's used in nuclear medicine imaging. Down below, we can find out what this study was measuring, and we see the primary outcome measures and the secondary outcome measures. So the primary outcome measures are the measures the researchers considered the most important for evaluating the effect of an intervention or treatment. And most studies will have one or two primary outcome measures. This study here had two: diagnostic yield and the number of participants with cancer diagnosis at 12 months. The secondary outcome measures are still of interest to the researchers, but they're less important than the primary measures. And most studies will have several of these. So here we see that the study had three, and they were related to sensitivity, specificity, and recall rate. Next, we have some information on the collaborators and investigators for this study. And then under that, a link to publications in scientific journals that are related to the study. Now, there are three different types of publications that can appear in this area. The first are general publications. Those are entered by the data submitters, and they can be about anything related to the study. So often research groups will publish on the background or the protocol of their study and not on the results. So those could appear here. The second type of publications you might see are those that are auto-indexed from PubMed. So the data submitters did not enter those. Those are automatically created by PubMed based on NCT numbers in those citations in PubMed. And then the third type of publications you can see here relate to the study results. Those are provided voluntarily by the data submitters. And we see that this publication is in fact a study results publication. All right. Next, moving down, we have study record dates, which track the progress of study record and summary results submissions. Then we have a section for some additional information, including a link to the record history where we can view and compare the different versions of the study and what changes were made to it over time. And then we have terms related to this study. These are keywords and relevant mesh terms for the study. These were all supplied by the research team when they registered the study. ClinicalTrials.gov does not perform any indexing of study records and does not apply mesh terms to submitted studies. And then lastly, in this more information section, we have links for drug and device information, study documents, and other helpful links. So this is often where you can access the study's protocol and statistical analysis plan or the informed consent document that they used. This study shares a nice Mayo Clinic YouTube video on molecular breast imaging that patients and family members would find really informative. All right, I'm going to go to the right corner now and click the back to the top button. And then we're going to take a quick look at our next tab. That's the researcher view. So this has a lot of the same information that we just looked at under the study details, but it's organized in a slightly different fashion, and it's marked in a way that's really useful to data researchers and journal editors. When results are available for a study, the Results tab is labeled Results Posted. So I'm going to click on that. The information here includes findings from the study and a summary of any health problems that happened during the study, but it does not include any conclusions or interpretations of the results. So for that, you'd have to go out to a study results publication. Okay, our first section here, the results overview area, provides basic information about the study. Then we have study record dates, and we have a section for participant flow. So participant flow shows the progress of all the study participants in each arm throughout the stages of the study. So it includes the number of participants who started, completed, or dropped out of the study. So here we see that 33 did not complete this study. Next is a section for baseline characteristics. These list the data that was collected at the beginning of the study from all of the participants in every arm or comparison group. And these include things like age, sex, ethnicity, and race. And note that there is no information included here that could identify an individual participant. It's all been de-identified. The baseline characteristics section will also include any study-specific measures that were collected from all participants. So in this study, we have data on menopausal status, mammographic breast density, and risk factors for cancer that were collected from all of the participants. Okay, the outcome measures section shows the data that the researchers collected during the study. So each outcome measure has this blue heading box here at the top, and it will have the name of the outcome measure, whether it was a primary or secondary measure, and then the time frame when the measure was taken. And this study has some wonderful detail here. It shares the statistical analysis that was conducted for each outcome measure. So it involves a lot of scrolling through this section. So I'm actually going to go back to the top of the outcome measure section and collapse that information because it would take us about 5 minutes to scroll down to our next section, adverse events. So this section summarizes all unfavorable changes in participant health, whether they were serious or not, that happened during the study or within a certain amount of time after the study ended. So note that the adverse events may or may not have been caused by the intervention being studied. They just have to be reported. Here we see that there weren't any serious or non-serious events that occurred. We can also review any all-cause mortality that occurred during the study. So that is how many people died for whatever reason during the study. Here we see, again, that mortality record was 0 for this study. Following adverse events, we have a section for limits and caveats. So that is any barriers or limits that may affect the results of the study. And there aren't any specified here. We have a section for collaborator and investigator information. We have a publications list, and the publications here are identical to those that we saw in the study details tab. And then lastly, we have some miscellaneous information here on agreements tied to the study. Okay, I'm going to click our back to the top button, and we're going to look at our last tab, which is record history. So this is a more direct way to view and compare the different versions of the study. You could click on any of these links here to see what changes were made over the course of the study. All right, so if this study was of interest to you, you have the option to download or save it. So to download, you just click the download button, and then you have your choice of file format and which data fields you'd like to include. ClinicalTrials.gov now offers the RIS format, which is compatible with EndNote, Covidence, RefWorks, and BibDesk. The maximum number of results that can be downloaded from your search results is 10,000. So that's pretty ample. But if you need a larger data set pulled, you can do that from API. To save studies, we'll click on that icon, and you'll notice this study was added to My Saved Studies. If we scroll up now towards the top of the page, we now have this link to My Saved Studies, and we see that there's one in that collection. I'm going to click on that link now, and here we are reviewing the My Saved Studies page. Here's my one saved study. If I click the box to the left of the study title, I can easily share this link with some colleagues by just clicking the copy icon. You'll see that the study was copied to a link. And then if I share that link with somebody, they can just open up a tab in their browser, paste that link in, and it takes them right to the saved study that I wanted to share with them. Close that tab now. So the maximum number of studies that can be saved at a time is 100. And the records that are in your saved studies will be saved there until you delete your browsing data and clear your cookies. So otherwise, they'll stay there for until then. If you do want to remove a study from your saved studies, you just make sure that box to the left of the study's title is clicked, and then just click the remove button, and then you'll see your study was removed from your saved studies. And now up here we see we have 0 in parentheses instead of 1. All right, I am going to click the back arrow one time and then go to our blue bar here near the top of the page and click on Return to Search to get back to our 17 search results to show you just one last function. So you'll see here in our action bar that we don't have a little button to click on to save our search strategy in the basic search interface, but we do have a couple of options available to us. If we go over towards the right side, we can click on the RSS button here in the action bar to create an RSS feed. So creating an RSS feed for a specific search allows you to easily access and browse recently added or updated studies meeting your search criteria. So we'll create this, and you'll see here in the title is the complete search that we just conducted. And we have the date and time when we did that study, when we did that search, sorry. And we've got that all saved there. And you will find additional information on RSS feeds and setting them up here under the Find Studies tab. We've got a link for RSS feeds. The alternative way to save your your search is just to bookmark your search results page. So here we are on our search results page, and you just bookmark it or make it a favorite like you would any other bookmark. And that resulting URL will include your search terms and filters in the URL. And then each time you open up that bookmark or your favorite page, you'll see all the current results for the search, including records that have been recently added or updated. All right, well, we really covered a lot, which may have made basic searching seem complicated. So I'm going to have you perform a quick basic search before we move on so you can see just how straightforward it is. So let's click on Home to get back to our search area here and go ahead and search for clinical trials on breast cancer that are actively recruiting near you. So in the condition disease box, we would type in breast cancer. And then in the location box, you can enter your street address, your city, or your state. And if you enter a street address, you can set a radius for how far you're willing to travel to participate in a study. So I'm just going to put in my city here, Duluth, Minnesota. And then down under study status, change this so that you have selected recruiting and not yet recruiting studies. And then go ahead and run your search and share in the chat how many studies on breast cancer are actively recruiting in your area. And we'll take just a second to do this. Great, we're getting some good numbers in there. And then you can apply some filters to those too if you want to refine by a certain patient characteristic, by age or health requirement. Great. Okay, any questions on doing those basic searches?
Erica, there just one came in. How do we restrict distance from our locations? Are you able to
Yeah,
show
I think
that?
you can set the radius for how far you're willing to travel to participate in a study if you enter a street address. I don't believe it will do that with city location. I don't think it does that. Just the street address.
Are you ready for other questions?
Sure.
Okay. Now a couple of them have already been answered, but I'm going to read them and that Christina had answered. There was a question about basically using creating searches with Boolean operators. And Christina suggested using the expert search.
Mm-hmm.
And there's also she said, please refer to constructing complex search queries for guidance. And that is in the drop-down menu under, I think, Find Studies. I can't remember which tab it is.
Yes, it is. Yeah.
Okay, so there's expert search and then down below
Constructing complex search queries. Yep. Yeah.
And then,
go ahead.
Those
Boolean operators are just like you're used to. They have to all be capitalized. So,
okay, well, that's good to know. Then there was a question about character limit. Basically, this was in relation to a systematic review search, but I think in general, is there a character limit for each section? And Christina's answer is the search fields do not have a character limit. However, I didn't quite understand this part. Search parameters go to the URL, and there is I see, and there's still a limit for the URL length. So I guess
right. Yeah.
So there's that. One just came in that I think is interesting. She asked if she had missed, but I don't think you mentioned it. How do you remove synonyms from search terms from the search strategy? So if you did not want all those,
Yep. There is a explanation of how to do that. That's under Find Studies. And I think you have to construct it in the expert search view. You can also build a complex search string in the other fields category, and that's where you put in a command to turn off the synonyms. It will only turn off synonyms only apply to the condition disease field. So you're just turning off those synonyms that are tied to your search there. It's not tied with any of the other fields. I believe that's right. Christina, is that true?
Yes, that's correct.
Okay.
All right, and then there's one that came in here, so I'm going to read it. This person said, many times I'd like to review the data and metadata standard used by the clinical trials on ClinicalTrials.gov, for example, CTCAE. However, I can't see much detailed descriptions. Could you elaborate how users can find more details about the data elements and data standards used?
Christina, that's under API, right?
Yes. So go to About the API, and then if you scroll down, so so study data structure there will actually show how the data is, built essentially within the study record, and you'll get some descriptions there of each of the data elements. And then there's also, again, within that About the API page, another one that has come up in chat a couple of times that I think would be really helpful for people is the search areas.
Yeah.
So that's actually a description of how each of the fields on the search form work and which sections of the study record they query. So for example, that basics, what we've labeled there as the basic search area. So that actually searches 57 different data elements within the record, and that corresponds to what's called other terms on the search form. So when you search in other terms, you're searching 57 different data elements. And then, of course, there's all of the other search areas as well.
Right. These are those, we mentioned that in the conditions disease search field, that it searched across 7 data fields. And so those are those 7 data fields there. Yeah, good questions.
Okay, well, here's another one. Okay, so Jeff just put in, and then I have one last question after this. How to request patient-level data. For some trials, the patient-level data were submitted to other repositories, such as Vivli. How can we find out where the patient-level data was submitted on, I guess, this website? He said on the website. Do we know that?
So that's individual study patient data?
So we don't have that on the ClinicalTrials.gov. That's only accessible if the investigators or sponsor decide to make that data available. And if they do, they often will note that in the study record. So it's called IPD for short, or individual participant data. And you'll see that it's marked yes or no or undecided. And if it is available, they usually provide a link where you can go and actually make that request. Sorry, Eric, I think I cut you off.
No, that was all I had to do. Yeah, I don't remember seeing, remember seeing links about how participant data was collected, how it's stored, how it's maintained, but I don't remember seeing links to the actual data. Like I think you'd have to go to one of the results publications, and sometimes they'll link out to data sets that way. Yeah, I don't recall seeing it within any study record.
Okay. And then the last question that came in quite a while ago said, well, do we see a bias in the voluntary trial reporters?
Christina, I'll let you answer that one.
Sure. So I will repeat what I said in the chat, which is that I can't speak to the bias. I can, however, say that the most common reasons that we're aware of are that, as Erica mentioned earlier in the talk, that the ICMJE requires prospective registration for publication in many journals. And so for PIs and sponsors who want to publish study results, they need to have that registration done already in advance of the study starting. That means before the first patient is enrolled. We know that sponsors and investigators also tend to register on ClinicalTrials.gov. We get a lot of the international submissions because other registries actually charge for registration. We do not. And then we do know that some data providers register for visibility, some even for patient recruitment, and then there is some who register for perceived credibility. And I cringe a little bit in saying that because as Erica stated, we want to make sure that users are aware that as the library, we are only making this data available. We are not responsible for and do not guarantee the safety or science of any of these studies. So just because it's listed on clinicaltrials.gov doesn't mean it's a good study or that it's, going to find, have worthwhile findings. But there are those who do register for that reason.
Great.
All right, thank you. And that was all, I think.
Okay. Well, we are going to move on to our handy search tip here now, and it's a quick one. It involves PubMed, so I'm just going to bring up PubMed. If you want to, it's just pubmed.gov. And we're going to use a field tag to quickly and easily filter PubMed results to those that are registered in ClinicalTrials.gov. And you'll find the steps for this outlined on your class handout. It's under Search Tip, Limit PubMed to Results with ClinicalTrials.gov data. So we're going to use the secondary source field tag to do this. Secondary sources include publishers, research institutes, and a variety of commercial and nonprofit organizations that are link out providers. And ClinicalTrials.gov is one of those link out providers. So the format for this secondary source field tag is ClinicalTrials.gov. You need to include the dot there. Then space, bracket, SI, bracket. So the SI in bracket stands for secondary source. So we're going to try this out. I'm interested in finding citations for studies dealing with vertigo that have also been registered on clinicaltrials.gov. So to do this, I'd enter my secondary source field tag filter right here, clinicaltrials.gov space SI in brackets, then space, and then the search term I'm interested in. So vertigo. And we'll run our search. And we brought back 133 results here. I'm just going to click on the first citation. And I will scroll down to under the abstract. And here you see trial registration. And we have our NCT number. And that's hyperlinked. So you just click on that NCT number. And you will go right to the study in clinicaltrials.gov. So pretty cool. So any questions on that? That was short and sweet. Great. And Rebecca has put that into the chat as well. Okay, we are going to go back to our PowerPoint slides now for the class exercise. Try to fit this in here before we run out of time. Here we go. I'm going to quickly explain the research case scenario that we're using for the exercise. And this is also on your class handout. So we have a trauma center that's interested in designing a study examining the use of virtual reality with adult burn patients during their wound dressing changes. And the research team recalls hearing about a couple of studies that utilize virtual reality, but they don't recall if the studies looked at a reduction in pain, a reduction in anxiety, in medication, or some combination of those. So the team wants to know what kind of research is out there that has been completed or is currently being conducted. And we'd like you to search clinicaltrials.gov for studies that might be helpful to this scenario team. And you can review some of those individual study protocols if they're included to look at what methodologies were used. You can note any trials that were started but then terminated before completion. Why was that? And just know that there's no single right way to do this search. So experiment with different entry terms and putting them into different boxes in there and use different filters and see how that affects your results. And we're just going to take about 5 minutes. I'll pop back in here at 20 after the hour. It's now 16 after. And then we can just talk for a few minutes if you want about your experiences and what you found. And also feel free to just enter things in the chat or ask questions in the chat as you're doing this. We'll all stay available while you're searching around in clinical trials. Okay, so we are at 20 after the hour. I hope that you had a little bit of time there to experiment and see how putting in different terms in different boxes, different fields there, changed your search results. Hopefully you found something interesting that might be of use to this research team. If you didn't, maybe you thought of some ways you could dig in a little bit further. We have reached the end of our class content. Since this was an introductory session, we focused on showing just how simple and straightforward basic searching in ClinicalTrials.gov can be. But as some of you have found out already, there's a lot more depth and complexity to explore. So if you'd like to build your ClinicalTrials.gov search skills, we recommend checking out all the constructing complex searches information that's available on the ClinicalTrials.gov website, and then looking at those data field that we brought up under the API tab. We also have a resource that's called Systematic Reviews, National Library of Medicine Products to Support Your Search, that the network of the National Library of Medicine put together. And you'll find a link for this handout in your class handout. Sorry, you'll find a link for this resource in your handout under Additional Resources heading. NNLM created this as a user-friendly guide to support systematic review work in key National Library of Medicine products, including ClinicalTrials.gov. And under that ClinicalTrials.gov tab, you'll find step-by-step help for building complex search strings, guidance on how to identify studies with unpublished research results, and information on how to document, save, share, update, and reproduce your search queries. We also have a handy 2-page PDF included there that you can bookmark or print for quick reference to ClinicalTrials.gov features and search commands. If you do use this resource, we would love to hear your feedback, and you can just click on that Share Your Feedback tab that is highlighted by the blue arrow on the screen there.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.